Assalamualaikum warahmatullahi wabarakatuh. In today's video, we are going to present about type 1 diabetes. For your information, this video will be presented by me, Esha Nureen Binti Eleeas, Syafiqah Nabila, Kaisah Balqis, and Syahirah Nabila. Let's move to the problem statement. The problem to be addressed through this case study is what kind of intervention that could be taken to prevent type 1 diabetes that affecting the children. For today's agenda, first, to explain about type 1 diabetes. Second, to explain the risk of complications of the disease. Third, we are going to explain the symptoms of the disease. And last but not least, we are going to elaborate the interventions that can be taken.
Hi and Assalamualaikum. My name is Kaisah Balqis Mohamad Najib, and I will be explaining about what is type 1 diabetes. Type 1 diabetes is an autoimmune disease in which the immune cell attack and destroy the insulin-producing cell of the pancreas, which means that the body attack itself by mistake. Type 1 diabetes, once known as juvenile diabetes or insulin-dependent diabetes, is a chronic condition. In this condition, the pancreas makes little or no insulin at all. Insulin is a hormone that the body uses to allow sugar to enter and produce energy. According to an article wrote by The Lancet, Diabetes and Endocrinology, in 2021, there were about 8.4 million of individuals worldwide were diagnosed with type 1 diabetes. There were about 1.5 million of individuals who were younger than 20 years old, 5.4 million who were aged in between 20 to 59 years old, and 1.6 million who were aged 60 years or older. And now I'm going to explain about what are the signs and symptoms of type 1 diabetes. For the first one, you may be losing weight without trying. In people with diabetes, the sufficient insulin can prevent the body from getting glucose from the blood into the body cells to use as energy. When this occurs, the body starts to burn fat and muscle to use as energy, and this can cause reduction of the overall body weight. For the second one, you can have a blood vision. Increasing in blood sugar or blood glucose can cause the lenses of your eyes to swell with fluid, causing distorted vision or blurriness. For the third one, cuts and razors that are not healing. If your body has a difficulty in metabolizing glucose, it can lead to high blood sugar levels. This can affect your body ability to heal the wounds. For the fourth one, you may have a fruity smelling breath. It is because when your body can get enough energy from glucose, it burns fat in its place. The fat burning process creates a buildup of acid in your blood, which is called ketones, which can lead to DKA, which is diabetic ketoacidosis, if untreated. The fruity smelling breath is a sign of high levels of ketones. For the fifth one, you can feel very tired. This is because when there is no insulin or the insulin isn't working effectively, the sugar in our blood cannot enter our cell. Therefore, our cells do not receive the energy they need, which can lead to tiredness. On to the next one, you can feel very thirsty. And the last one, you pee more than usual. This is because when the kidneys cannot keep up, the excess sugars goes into our urine, and it also takes along liquids from our body tissue that causes dehydration and also frequent urination. Okay, the next one I will be explaining about what are the causes of type 1 diabetes. For the first one, it may be caused by family history. Anyone with a parent or a sibling that have been diagnosed with type 1 diabetes has a slightly higher risk of getting the same disease. Secondly, it can cause by age. Type 1 diabetes can appear at any age, but it appears at two noticeable peaks. The first peak is between 4 to 7 years old, and the second peak is between 10 to 14 years old. For the last one, it can cause by geography. The number of people who have type 1 diabetes tends to be higher as you travel away from the equator.
Assalamualaikum. My name is Syahirah Nabila Binti Mohamad Suhairi, and I will be presenting about what are high blood sugar level. According to Cleveland Clinic, high blood sugar, or we call it hyperglycemia, is when the level of sugar in your blood is too high. It mainly affects the people who have diabetes and can be serious if not treated. So what are the causes of high blood sugar level? Firstly, your blood sugar level can spike when you're feeling unwell or stressed. Secondly, eating too much sugary or starchy food can also be one of the factors. Lastly, being less active than usual and missing a doses of diabetes medicine. What should be your ideal blood sugar level? Based on a chart of normal blood sugar level by Breath Wellbeing, a normal person without diabetes and when they are fasting, their blood sugar level is 70 to 99 milligram per deciliter, and when they are 2 hours after a meal is less than 140 milligram per deciliter.
So, let's know more about insulin replacement therapy. This insulin replacement therapy is also referred to as intensive insulin therapy or basal bolus therapy. It is a comprehensive approach to helping patients to achieve optimal blood glucose control by mimicking the physiologic delivery of insulin. This approach uses current understandings of factors affecting glucose homeostasis to empower patients to use flexible insulin dosing to match their lifestyle. So, what are the components of insulin replacement therapy? The components of insulin replacement therapy, first one is self-management. Self-management needs cooperation from patients themselves. They need to understand about insulin administration educations, which is they need to understand the types of insulins, their action times, dosage calculations, and proper injection techniques. This will help patients to aware more about their insulin intake. The second one is about patient support. This is a coping strategy. This technique is actually to cope with their emotional and psychological aspect of living with diabetes. This actually help the patients to cope with their stress. The third one is about meal planning. This meal planning is a consistent carbohydrate intake. This is a modality in which the patient has a carbohydrate budget to use for each meal. This approach is useful for patients who are being introduced to insulin replacement therapy because it may better stabilize blood sugar and assess response to prandial insulin. Last but not least, is a more crucial is about self-monitoring of blood glucose, which is SMBG. This is a critical component of insulin replacement therapy. The result of fasting is useful to help evaluate response to therapy and to make appropriate treatment adjustment. This information also helps identify blood sugar patterns and glucose variability. These all the components help patients type 1 diabetes to be more actually aware about themselves and help they to mimicking their normal blood sugar level that we have as a normal human being.
Next, let's talk about what intervention that could be taken for type 1 diabetes. First intervention that could be taken for kids and adolescents that have type 1 diabetes, which is exercise regularly. People with type 1 diabetes must at least aim for 30 minutes per day and 5 days a week to do physical exercise. So basically, exercise can help us with mood and weight management. But people with type 1 diabetes may see extra benefit from exercise, such as lower insulin needs. People with type 1 diabetes must at least try to aim for 30 minutes a day by taking a walk, or swimming, or dancing, or weightlifting. But different type of exercise may affect your blood sugar level, such as aerobic exercise and anaerobic exercise. First, aerobic exercise. Aerobic exercise is continuous, like to be moderate intensities exercise, such as running, swimming, and biking. This type of exercise may lower your blood sugar level, so less insulin and more carbohydrate may be necessary. Next is an aerobic exercise. An aerobic exercise is a short in duration with higher intensity, such as gymnastics, sprinting, and weightlifting. This type of exercise will increase your blood sugar level, so more insulin may be necessary. Next is taking insulin. For your information, insulin is a medicine to help our body to use glucose for energy. People that have type 1 diabetes cannot produce insulin, so they will need to be prescribed insulin to prevent the blood sugar from getting too high. Next, how to take your insulin? There are two ways to take your insulin. First is we can use insulin pen, and second is we can use insulin pump. Next is monitoring your blood sugar level. People with type 1 diabetes must check their blood sugar level 4 to 10 times a day. This includes before meals and snacks and before and after exercise. Last but not least is to control your portion or diet. Malaysian health government stated a healthy diabetes diet plan must consist balanced portion of carbohydrates, protein, and fats. Last topic that we will discuss in this video is risk of complication disease for type 1 diabetes. First is heart and blood vessels disease, such as coronary artery disease. Second is nerve damage that affect hands, feet, legs, and arms. And then is osteoporosis, which is a health condition that weakens bones, making them fragile and more likely to break. And the fourth one is eye damage. Eye damage caused from blood vessels in the retina start to bleed into the vitreous, and you may see dark, floating spot or streaks that look like cobwebs. And last but not least is kidney damage. Med India states that diabetes reduces the kidney's ability to clean itself. And this is our reference that we take from our research. And that's all from us. Thank you. Bye.